Hi and welcome back. My name's Kirsty. If you're new here or if you don't know me, which is quite likely because I don't have many subscribers, but I love each and every one of you that are subscribed. So my name is Kirsty, and today this video is going to be all about the MOUNJARO Kwikpen. Now, the reason why I wanted to do this is because when I got my Kwikpen and I did my first injection, it was nerve-wracking because let me tell you, the written instructions aren't great. And obviously the USA does not have the Kwikpen, they have the 4 individual doses. And I think their way of doing it is a little easier because you basically just pop it on your skin and it does all the work, as far as I can tell. But this video is going to be in 3 stages. It's going to be when, where and why, and how. So if you just want to skip right to how, I'll leave a timestamp right here or down below. I don't really know. I got a bit ahead of myself there. I'm not really too sure how to do all of that, but I'm sure I'll figure it out. Anyway, let's just ignore all of that and let's just get on with this video. So, just a disclaimer. Please, 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 will you contact your own physician or your own doctor for advice and guidance on how to use the Kwikpen if you're not sure. I'm in no way a doctor. I'm not saying that I'm a doctor. This is just what the research that I have done and what works best for me. But again, not taking any responsibility for anything that goes wrong. Please consult your own physician and your own doctor. And I say that with love because I don't want you to get hurt. Not that I don't really think you could get hurt, but just in case. Just in case. Right, so let's start off with when. So formally, it's every 7th day at the same time. So for example, I took mine on the Saturday at 1 p.m. So I should have taken mine 7 days later, Saturday at 1 p.m. However, I didn't do that because I found that my hunger and my food noise was really, really strong the following Thursday, and I just didn't think I could hold off until the Saturday. Probably just a little bit weak-willed, but you know, I am in the position that I'm in because I don't have a lot of willpower, you know. So I took mine on the Friday at 9:30 a.m. and I didn't notice any difference in uptake speed, if that makes any sense. So when I took my first dose, all the food noise went away within like an hour, and the exact same thing happened for me when I did it on the Friday as well. And now the 3rd dose that I took was the following Wednesday, so that was the 5th day. And again, I did this because hunger had come back, food noise had come back, and I'm not saying that I panicked, but I was uncomfortable. It was uncomfortable. I felt uncomfortable in my body again. I didn't really think that I could stick it out for 2 more days. So I then did it on the 5th. Now the guidelines are that you can take the dose every 3rd day. So as long as you leave 3 days in between. So if you take it on the Monday, Tuesday, Wednesday, Thursday. Okay, you just take it on the Friday. So it would be the Friday that you could take it on, Monday to Friday. That's the official guideline that I found doing my own research, but if your physician says differently, then your physician says differently. Everyone's doctor is going to be a bit different on this. So for me, I take it every 5th or 6th day. So my 4th dose should be tomorrow, which is why I'm filming this video now, so that I can show you how to actually do the whole thing tomorrow. So you'll get the joys of morning Kirsty to show you how to do that tomorrow. So enjoy that. Okay, so with that being said, there's 4 doses in the Kwikpen, but there is an extra 5th dose that people have been savvy enough to find out and get out. And it's usually between 0.4 and 0.9 mil, and a regular dose that comes from the pen is 0.6 mil. So you're either getting a little bit less or quite a bit more, to be fair. But I will show you how I am going to get that 5th dose out of the pen. Nobody's quite sure the reason why there's that extra 5th dose in the pen. some people are saying it's because when you prime your needle and the liquid comes out, that it's to compensate for that. But when I prime my needle, only a drop comes out, like a tiny little drop. So I'm not really too sure about that. Maybe it's leakage, don't know. But people are getting full doses, a full 5th extra bonus dose out of that pen, which is fantastic considering the price of these medications. So if you can make it last 5 weeks instead of 4, it brings the price down a little bit, so it just helps your pocket. Now, okay, so now we're going to discuss where. So the guidelines are in your stomach, and I think it's 2 to 3 inches away from your belly button. You can do it in your thigh, and you can do it in your upper arm, like the back of your arm here. So, are there any differences, and why would you choose one or the other? Now the guidelines say to rotate your sides, so do your stomach 1 week, then your thigh the next, and your arm the next, and that's to combat any swelling or any pain that you may get, I guess. I've only ever done mine in my stomach, and it doesn't hurt. I don't get any swelling, I don't get any residual pain, I don't get a red mark, I don't get anything. So I'm quite happy just to stick with my stomach and going from right to left and right to left and right to left. If in the future it does start to hurt a little bit, I'll probably go to my arm. Because I'm an apple shape, I don't have a lot of fat on my thighs. They're actually quite weeny. So I will probably go to my arm because that's got a bit more of the squish on it compared to my thigh. So the interesting thing about why you would choose one site or the other is I've had a look on the MOUNJARO UK and Setbound Reddits, had a look on there, asked a few questions, and I found that the consensus is that the thigh hurts the most, but it is most effective in terms of weight loss. Stomach hurts the least, but there's less loss than on thigh. And arm was more weight loss than stomach, less than thigh, but more side effects than stomach and thigh. I think that's what it was. The reason why I'm confused is that there was a lot of contradicting within all of this information. So some people were saying the complete opposite. And I can't find any scientific research to back up any of this. So it looks like it's anecdotal. As I said, I've only ever done my stomach. I've not had any symptoms that I can think of. I mean, I don't even think I've had constipation. I think I've just had less bowel movement because I've been eating a lot less food. But it's been easy to go. Like I've not been constipated. I've not really felt constipated. So that's the only thing that I can think of from my side effect. And I felt that hit of medicine straight away in my stomach. So for my last dose on the Wednesday, I was really trying to hold off until the Thursday or the Friday, but I just couldn't. My hunger had come back and I'd eaten and I was still ravenous, and that food noise had properly crept back in. So I was like, I'm gonna have to bite the bullet. I'm gonna take this medication. It's been more than 3 days. I'm safe. I can do it. I've checked. It's good. So I took it, and I could literally feel it like spreading through me. Now I'm not sure whether that's a placebo effect or not, but within half an hour, I was like, I'm good again. I've got that restraint. I know what I'm doing. I can hold off until an actual meal time and not have to just eat everything in the house. So that was really nice and refreshing. So now I just want to show you basically the supplies that you should get with your first order. So the first thing that you get is a sharps bin, a lovely sharps bin. It basically pops open. She says, I literally can't get it to pop open. Okay, this is taking too long. I can't do it. I think that's accidentally been locked. It'll be fine. I'll work it out. But yeah, you get a sharps bin. I believe that once this is full, you can take it to a pharmacy and they'll dispose of it for you. There, I did it off camera. Oh, phew. Okay. The next thing that you'll need is some 70% isopropyl alcohol wipes. I got a bunch from Amazon, literally for about £4. Can't really remember. They're just like this. Now these are important for wiping down the pen and also for wiping down your area that you're going to be injecting to. Again, I'll show you all these again tomorrow in the morning before I do my injection so that you can get up close and personal with them all. Then what comes with the pen is a pack of Nova Fine needles. I believe these are insulin needles, and the size is 32G 4mm. Now the bigger the G number, the thinner they are. So a 32 is thinner than a 30. I hope that makes sense. So they look like this. So they've got a sterile tab, and then inside that there's another little lid, and then the needle. But again, show you that tomorrow in the morning, a bit more in depth so that we can properly see. And then the next thing that I've got here is some disposable insulin syringes. I got these off Amazon. I don't really know how I feel about that. The reason that I got them off Amazon is because I couldn't find any medically that were 32 with 32G with lower than 12 millimeter, and I really didn't feel like sticking a 12mm long needle in my stomach. You know, these ones are only 4mm, so you know that's 3 times as big, and these ones are 6mm. Now I will show you these ones when we're getting the 5th dose out, because I'll talk you through how to do that as well. It says they're sterilised by EO gas, single use only, valid for 5 years, sterile. I got recommended these by quite a few people on the MOUNJARO UK Reddit, and they've all sworn that everything's gone fine, they've had no issues with it. So, you know, I'm not too concerned about it, but I think next time I probably will source it from a medical site if I can find one. Now again, if you can hear my dog, I'm very sorry. I always seem to film these around meal times. This is Hamish. He's not one for cuddles. But he's a very, very sweet boy. He's just got some medical issues that make him a bit on edge, bless him. And then the last thing that I need to show you is the actual pen itself. So it comes in a box like this. It's got all my information on there. Use by date is on the bottom. So this runs out at the end of May 2024. And the pen itself looks like this. So it's got the dosage, it's also got the expiry date on there. So it's 4 doses of 0.6 ml solution, 2.4 ml solution that can be administered once weekly, 2.5. And again, there's a 0 there. So when you prime your needle, you'll do 2 clicks. But don't actually, do you know what, there's no point getting into that right now because we'll be doing it in the morning anyway. That's what it looks like out of the pen. This is where I've already used the dosages, and I don't know if you'll be able to see the notches, but there's 1 notch here and 1 notch there. The notch between the liquid between the 2 notches is my next dose, and then all of that liquid that's left at the side of this dose is the bonus 5th dose. So, with that all being said, I will now pass you over to future morning Kirsty. Be kind to her, she doesn't always look great in the morning. And then I'll see you shortly afterwards. Right, so it's now the morning. My son's left for his toddler group, So I'm about to do my injection. So I've got all my things here. I've got my sharps bin. Gosh, this is really strange because I'm not quite sure where the camera is. I think it's there, yeah. I've got my sharps bin. I've got my wipes. And I've got my syringes and the pen. Okay, so first thing we need to do is get a couple of things out. So we need to get wipes, isopropyl wipes, a syringe, and the pen. I'm going to stand up to do this, so it's just going to be a bit easier. So we've got the pen here. The first thing we're going to do is open a wipe. And that red dot there, you're going to wipe down with that wipe. Okay. Then take your syringe, peel off the strip, like that. The needle is just inside there. You might not be able to see it. Pop that on. And then take that off. Then I'm going to do 2 clicks. Like that. Take off this little piece here. Give it a tap. And then prime your needle. Just a couple of drops came out there. And then this here, you're going to turn it until it turns to 1. It's 60 clicks, so it's quite a long time. If you wanted to do half a dose, it's only 30 clicks. That's what somebody has found out on the Reddit sub, which is quite interesting. So we're going to give it a turn. And don't worry, because you can't go past 1. Once it's there, it's there. You can't go any further. It does take a while. Look at the length. It's quite a big lot that comes out. So I'm going to take a step back and show you. So sorry if you see something you don't want to see. Take my wipe in the site. Inject the needle. Push down. Until it's back at 0, and then count to 5. 1, 2, 3, 4, 5. Withdraw the needle. And then pop that lid straight back on so we're not getting any needle stick. That won't be cool. And then I'm just going to check. There's a tiny little bit of blood. And then that's the needle part. So then twist this until it comes off. Pop on the cap. And then this goes into the sharps bin. And then that's it. It might be worth mentioning that I take mine out of the fridge about 20 minutes before I use it, just so that it warms up to room temperature, and then it's nowhere near as, I mean, it's not painful at all, but if it's colder, you can definitely feel it going in, but it's not painful. So yes, that is how to use the Kwikpen, and I'll take you back to past Kirsty, because I'm future Kirsty. So I'll take you back to the past Kirsty. All right, okay, I hope that was helpful. I'm sure I'm feeling very relieved to have that good GLP-1 spreading through my system right now. And yeah, so to end this video, I just want to talk about something that I have read while I've been doing some research. There's a fantastic podcast called The Plus Sides So it's plus sides, and sides is a Z on the end. I listen to it on Amazon Prime, but I think they're available pretty much in anywhere that you can get podcasts. And it's fantastic source of information because they have a lot of doctors come onto the show. Now, for those of you that are a bit worried about listening to a podcast and there being doctors on it because you're used to diet culture and you're used to obesity bias, and you know the stigma of using a GLP-1 to lose weight, don't worry about it. All these doctors are super, super lovely. They're non-judgmental and they're fountains of knowledge. And they have a lot of information on there about, because this is from a year ago. This podcast is from a year ago, and it talks about where they're hoping to take GLP-1s and stuff like that. That's a really, really good source of information. But on there, they were saying about how there's a possibility in the future for, in the UK, it's not going to happen in the US. In the US, that it's basically been vetoed. I'm not sure why, but in the UK, they're thinking of dispensing MOUNJARO in vials, similar to how they used to do insulin. They do this currently in a few European countries. I know Germany does it. I'm not sure about any of the others on the top of my head. But the main reason that they're thinking of doing that is because of the shortages that they've been experiencing. And what a lot of people don't realise is that the shortages aren't because I nearly dropped my pen then. I think I've actually just put my heart into my throat. Ooh, what a lot of people don't realise is that the shortages aren't because there's no medication. It's because the pens take so much time, energy and resource to make. Now, if you think about it, they are quite complicated. There's a lot of components to them and they can only be used once. So I think a way of combating that is by putting it in a vial. Now, my question to you is, if you are taking MOUNJARO, how would you feel about using a vial? Would you be comfortable in drawing up that liquid and dispensing it yourself, measuring it out, making sure your dosage is correct? I personally would be, because I'm planning on using my insulin syringe to draw up that 5th dose anyway. So I think I technically would be fine with it. But a big factor of that is that it may put the price down by quite a lot, because this Eli Lilly could still charge quite a lot of money for these vials, and make a lot of money off them. Say they went down in price to £100 instead of £200, they'd be making a really similar amount of profit because the pens are so expensive to make. So it's definitely something that could happen in the future. Yeah, I'm quite excited about that. So my next video will be talking about my week 3 progress, what I've lost, if I have lost, measurements, all of that. That will be discussed in my next video, which will be released on Friday. After that one, I would also like to do a video on showing how to do the 5th dose for those that are interested. If you're not interested in that, then you know, if you think it's all a bit too much Breaking Bad, you know, then just don't worry about it. But you don't have to watch it. It's absolutely fine. No hurt feelings here. And then I would also really, really, really love to do a video about the stigma of using GLP-1s for weight loss, and just my take on it, and how I feel about that. Because I've got some thoughts. And then I probably will just do like a general my history and why I'm on GLP-1 medication and how it's working for me. So yeah, so lots of lovely videos coming your way. If you like this video, please do give a like, comment or subscribe if you want to stick around here. I am so grateful for every single one of my 26 subscribers. I love you all and I'm so happy to have you here. I have one lovely lady all the way from Australia leave me a comment. That's astounding to me. So thank you for watching me all the way from Australia. Yeah, please stick around. I would love to have you on my journey and learn about your journeys too. I always try to reply to the comments. I love meeting you all, and I love that we're going to have this relationship together, that this companionship, we can do this morale boosting environment, all the peace and love, and I will catch you in the next one. And until then, take care. Bye bye for now.